Well, believe it or not, we are at the last formal session of the day. This will be my last time talking to you, so I just want to again take an opportunity to thank Mike Milken and the Milken Institute, and to more than anything thank you for coming, spending your precious time learning about this unbelievable organization called the U.S. Centers for Disease Control and Prevention. To get this next session kicked off, which Mike Milken will be moderating, and this session is on the business case for public health, we want you to watch a brief video, and then we'll welcome Mike.
Most people don't realize that 100 years ago, the leading cause of death in the United States was tuberculosis, TB. But by the 1970s, TB was eliminated from the United States. Back in 1987, Oprah Winfrey talked about HIV and AIDS and predicted that 1 in 5 Americans would die from the disease. Today, it's treated like a chronic disease in the U.S.
CDC works 24/7 protecting Americans from threats, whether those threats come from this country or anywhere in the world, whether they're infectious or non-communicable, whether they're intentional man-made or naturally occurring.
By focusing on all of us, CDC has helped each of us.
When our country tries to estimate the economic cost of life-threatening diseases, they dramatically underestimate the true cost, the emotional effect on the family and friends, what's occurring in the workplace as you're dealing with this disease. That is why the CDC efforts in the community are so important. They reduce the effects of cancer, heart disease, and diabetes.
Tobacco causes 440,000 deaths in the United States every year. It is the #1 cause of preventable deaths in the U.S. CDC is the lead federal agency in comprehensive tobacco control and prevention. We really work to support state programs so they're effective. And the Tobacco Laboratory, we're able to measure both the addictive substances and the toxic substances in tobacco products and in tobacco smoke and in people. We're able to figure out what are the things that are causing such high rates of disease and death.
We don't know what the future will bring, but the reason I'm so focused on public health and the work of the CDC is the scientific research and data and capabilities of the Centers for Disease Control will enable us to deal with those life-threatening diseases, whatever they might be.
Fundamentally, we have one and only one goal: helping people live longer, saving lives. The bottom line for me is, how many lives did we save?
Well, good afternoon. Many of you were with us at 7 in the morning this morning, and after the next 45 minutes, we're going to be giving you your tours, if you haven't had a chance to get them, of the CDC. So we have 5 extremely talented and diverse panelists here, and we're going to take a look at the business case for public health. We all recognize that every human life is precious, but one is the business case directed and is doing good business. So one of the places I'd like to start is kind of each individual's career, where they are today, how did they get there, and how does that concept of doing good is good business interrelate with those stops along the way. And so Mehmood has had a very interesting career, whether it's the Mayo Clinic or pharma, and today at PepsiCo. And you know, the first choice that you would be thinking about for a person who had been at the Mayo Clinic or pharma is, you know, I'm going to go work now for one of the largest consumer product companies in the world, who's in 198 countries. And so your goals when you started, the mission you set out, how does that fit PepsiCo today, and why did you make those decisions?
Well, at PepsiCo, from a business mission perspective, we think of ourselves as performance with purpose. And under that, we think about environmental sustainability, talent sustainability, which is our employees, and then human sustainability, our consumers, health, and nutrition, which is the business we're in. And when I looked at the opportunity, it was pretty straightforward. PepsiCo reaches 1.3 billion consumers every day consume a Pepsi product. It's about 1 in 6, somewhere between 1 in 5 to 1 in 6 humans on the planet every day. At the same time, we know there's about 1 billion people who are overweight and there's about 1 billion people who are hungry. What greater opportunity for an endocrinologist to take a look at transforming the industry's portfolio, not just the companies, being one of the leading companies. So as I look at that in my career, having started in nutrition, gone to endocrinology and then to pharmaceuticals, this to me was a tremendous opportunity.
Could you talk and look at, from your standpoint, how you look at your various stakeholders and how the company, whose direction or long-term strategic direction is shaped around those stakeholders?
So we, like any large food and beverage company, we have stakeholders across our supply chain to start with, including our farmers, the communities that produce the commodities that go into our products, our entire distribution and sales system, but ultimately our customers and our consumers. And even in our consumers, we think of two groups: our shoppers, which often are parents, loved ones who are shopping for somebody else, and then ultimately a consumer. Amazingly, our employees are our consumers, our suppliers are our consumers. We're one of those industries where everybody plays multiple roles and interfaces with us in multiple ways. Our investors are our consumers.
So you have a lot of touch points from that standpoint. Rajiv, as one of the largest biotech investors in the world, one of the things we've always focused on is access to capital. And what does that mean? And it's interesting, as I was looking back in history, as the question of who invented air conditioning. And if you quiz people, they tell you, well, they think it was a guy named Willis Carrier. In 1906, he built an industry, invented air conditioning, etc. But in fact, as I studied this issue, there was a doctor named John who thought of this idea and tried to invent air conditioning in 1835 and actually patented in 1851. But he was unable to get access to capital, and unfortunately he died broke. And he was really focused on how do you keep the operating room cold and ice and other things. And so often we think about things, but not everyone had access to capital. So from your seat, you see today that more and more of the venture capital firms are withdrawing from bioscience. There's a lot of challenges today. And what does the world look like from yourself at Fidelity?
Okay, well, thanks a lot for having me here. It's a real privilege to be here. And I love being here at the CDC. I just love the museum. A lot of the great companies that we've invested in the last 20 years, 18 years that I've been at Fidelity, were really involved in a lot of the changes that occurred in society over the last 15, 20 years. For example, some of the HIV drugs that were developed by a lot of the HIV companies that we've owned and continue to own. There was a CDC initiative for latex gloves around the HIV epidemic, and SafeSkin was a company that started making latex gloves that was acquired by Johnson & Johnson. So there's a lot of these small stories that I have going through my head as I walk through these great walls. To answer your question, Mike, biotech is probably the worst business in the world and the best business in the world. And I think it's the worst business in the world because at the core of it are a bunch of really brilliant scientists with great intentions. They've got a great idea, and it's in a test tube. And most of those ideas are not going to work. They're going to fail. And they're going to cost hundreds of millions of dollars to develop. So someone has to take that risk. And you've got to go through the FDA, so it's a regulated business. It's competitive. So that makes it extremely difficult. The odds are against you. 9 out of 10 new biotech companies fail. The flip side, why is it the best business in the world? It's the best business in the world when you have a breakthrough. All of a sudden, you have a monopolistic product that's patent protected for 15 to 20 years. You now have a global industry with 9 billion people. The level of need is extremely high. If you have a new breakthrough drug, Kalydeco, for example, Vertex Just got it approved last year for cystic fibrosis. It penetrated the whole patient population in 3 weeks of approval. So you can have very rapid growth. You can generate a lot of great cash flows. You can build an R&D company. You can build a great company like Celgene. And so that's the nature of the business. And to me, as I think of the world today, it's never been better because the science has never been better. A lot of great secular trends in the industry. Others talked about it today. The cost of genomics has just dropped so substantially from millions of dollars to a few $100s in a very rapid period of time. The proliferation of diseases, Francis Collins at NIH talks about this, 6,000 diseases now where we have some kind of molecular basis and understanding of what's driving these diseases. We only have about 250 treatments. That's going to catch up, and that's going to be a really great period, I hope, in the next 5 and 10 years and 20 years for great medicines that are going to really solve serious medical problems for patients. And so in the context of this great opportunity, you've had the global capital downturn that occurred across sectors that we're still sort of recovering from. And the pharmaceutical industry, which controls a lot of the capital, has gone through major patent expirations and I think existential questions on what sort of business they're running. They've gone into a cost-cutting mode rather than an investment mode at perfectly the wrong time. The NIH is caught in budget battles, and that is a hard uphill battle there for funding, and the NIH has done such important work. So I guess the answer to the question is I've never been more optimistic, but it's also the challenges have also not been any greater.
So asking you the same question, if you look at your career path, how does one get to be potentially the largest biotech investor in the world? How did you choose biotech?
See, I got lucky, is I think the thing. I mean, I love the field. I was always interested in science as a kid. When I was in India, I was a computer science person. I came to the United States, went to Harvard, and I was interested in a lot of different things, environmental sciences and policy. And it was the mid-90s, and it was the Soviet Union had fallen, and it was the end of communism, and capitalism had won. And just as an undergrad, I wanted to understand what that meant. And I wanted to understand how one could bring sort of science and capital together. And Fidelity hired me right out of as a Harvard undergrad, and they said, well, why don't you invest in biotech companies? This is 96. Nobody wants to invest in this sector. It's a great way to lose money. They're lottery tickets. And, it's good for someone like you who knows nothing about anything. And I've been there ever since. The funds have gone from $1 billion in assets to $10 billion in assets. And I'm also responsible for Fidelity's investments in biotech across the generalized funds, which are over $50 billion in holdings. And that's the story so far.
Well, we're happy.
And I hope it's just the beginning, and I think about the biotech industry, and just in terms of, if you think of biology as a science, it's such a new science, Take physics, for example, and electronics and all that stuff that's happening in the tech sector. Newton is sort of the pioneer of physics, and it's been hundreds of years since Newton was there. Jim Watson is still alive. The discovery of the DNA is a very recent discovery, and the building blocks of biology, biochemistry, and the structure of DNA, and the driving forces on a molecular level of all of life is just being understood and discovered as we speak. So from that perspective, I feel just extremely optimistic about the future.
And you mentioned to me the honor just of walking into the CDC with an individual who you felt made enormous contributions to society.
Yeah, I've got a picture of him. I'd love to put it up here. And I just wanted to highlight him. Morris Hilleman. And people always think that, and I'm sure a lot of people at CDC know him. And you often think of businesses and pharma companies and biotech companies as being self-interested and not doing the right things for patients. And I disagree with that. I, as an investor in a lot of these companies, for me, the best companies, the best investments have been the ones that are best for patients. And the best thing you can do for patients is prevention, cure, affordable medicine. And when you do that, you can really change the world, and you can create great returns for your shareholders. And Morris Hilleman he developed 8 of the 14 vaccines that are routinely administered to children today. In his career, he passed away in 2005. He started doing his work in vaccines in the 1950s. He developed over 40 vaccines, including the measles vaccine, the mumps vaccine, the rubella vaccine, the triple MMR vaccine. He got the strain of the mumps virus from his daughter in 1963. He spent 40 years working for Merck. The MMR vaccine, and there's a great slideshow right down below the stairs that I saw earlier, but the CDC's one of the biggest initiatives in 1967 was the measles vaccination. It was his discovery, it was his invention. It's what built one of the biggest pharmaceutical companies in the world, Merck Vaccines, and it's a great example of how doing good can be great for business and great for shareholders. So I just wanted to highlight him in this context. He should have won a Nobel Prize. He's credited as being the scientist that has saved more lives in the last 100 years than any other scientist. The mumps vaccine itself, the measles vaccine itself has saved over 1 billion cases of measles, saved the lives of 9 million people. It's one individual and one pharmaceutical company. And there's a lot of really smart people out there that I meet every day that are really in this to do the right thing for patients. Hep C is another great example recently where we've cured the disease, and it's been a real great industry effort. I can go on and on, but I'm going to stop
Fine.
here.
So I think the issue is that we should leave today that we have been very focused on new financial structures. I've spoken to Rajiv of how you're going to finance bioscience in the future. And I think this year will bring a number of new structures. If I go back to the formula that just changed my life that I had written down in 1965 at Berkeley, you can see that the importance of access to capital is serving as a multiplier effect on these issues. And I take you now to Steve Berg. And Steve and I talked often. His company, Safeway, majority of the employees are union employees. They had a strike in Southern California that was very costly to Safeway and the other companies in the industry. And I told Steve, you've got to find a way that your employees believe that you're interested in their best interests, that your interests are aligned. And the easiest way to do that is to focus on their health, the quality and length of their life. And more maybe than any other CEO in the last decade or more has changed the world for his employees. Steve, why don't you recount your experience here?
Sure.
From running a large customer of PepsiCo,
Okay.
To getting involved in health and things like that.
Sure. My involvement in healthcare stemmed from the fact that I was running a business that was it's a low margin business. It really counts on volume, make 2 or 3 cents, per dollar of sales. And we had a $1 billion healthcare bill in 2005. And we prided ourselves in being able to solve almost any problem. That bill was rising at the rate of $100 million a year. And so I got very personally involved in healthcare and began to understand just how confusing it was in just about every single aspect. Nothing was working. It's the largest single sector of the U.S. economy, and it's not a failed market. It's a failed hybrid market. Okay, it's not really, it doesn't operate with market conditions, and so we tried to create that. And to go to Mike's point, post the strike, Mike, contrary to what most people might think, the unions actually became among my best friends. And for this reason, healthcare costs for them were completely out of control. And if you've done any reading about unions these days, pension expenses and healthcare is eating up all the money, denying them wage increases for almost a decade. So we demonstrated that we could control healthcare costs, and therefore we could grant wage increases along the way. We had a dramatic effect on the health of the workforce. One of the things we did, I believe in the 80-20 rule with 80% of the benefit comes from 20% of the effort. And 4 chronic conditions explaining 74% of healthcare costs, most of them behavior driven. what a wonderful place to focus. So we focused on those chronic conditions. And for people that failed our biometric standard on blood pressure, 2 years later, 73% of them passed. For those that failed the elevated glucose test, and we use the A1C test because it's more comprehensive, and the beauty about that measure is I know of no silver bullet. The only way to get that number down to improve your glucose level is to eat differently, lose weight, and exercise more. And 2 years after the introduction of this measure, 45% of those that failed then passed. On cholesterol, 43% that failed passed. Tobacco, 35% of them quit smoking because we had the right incentives in place. Body mass index, which we know is not a perfect measure, but it's the most popular measure out there. David Heber and I have talked about maybe substituting a new measure for that, which I'm willing to experiment with. But we had a 21% reduction in the obesity rate at Safeway. I was determined to make Safeway the lowest obesity. I wanted to be the lowest state in the nation. Colorado was occupying that position at 20. And when I left, we had that down to 21%. And one of the things that I think Mike made this transition, because we do something different than most companies. You might have 40% of the companies in the United States that have biometric standards. Very few of them have outcome-based standards. And the reason very few of them have outcome-based standards is there's a very narrow navigation path between ADA and HIPAA, and we put the effort into it to find it. We lobbied for some legislation to expand the degree to which you can base premiums on biometric standards. The old law said 20%. We argued for 30 to 50%. The way the regs came out, if you have smoking as one of your biometric standards, and we did, you can actually go to 50%. So if your healthcare costs average $8,000, you can have a $4,000 difference between those that fail all standards, and it's not considered discriminatory as long as you give people a way to earn that back. And so in our case, if they make 10% progress on their BMI, they'll get a check at the end of the year as if they'd never had an elevated premium. They would be in the penalty box again the following year because they've got some more work to do. But while we get a lot of sort of airtime, I think, for what we did there, that represented only 15% of the savings. And we basically cut our healthcare costs in half from what they were projected to be. We took $1 billion, and 8 years later, it's $850 million. And along the way, again, working with Mike Milken, I got very involved in cancer, having a cancer diagnosis myself 14 years ago. And we started raising money in our check stands in this low-margin business, and many of you have had that experience. And we raised over $200 million for cancer research by focusing on breast cancer and prostate cancer. And then lastly, I think, and it's important, Mike, we created a cancer concierge function. When I was diagnosed with cancer, I could just call Mike and say, hey, what do I do? But my employees could not. So we created a concierge function. We financed it at UCSF. They operate as a hub. And if one of our employees in Houston, has been diagnosed with cancer, whether it's a clerk in the store or a senior executive, they get introduced to MD Anderson. And so when you're willing to cotton swab the inside of someone's cheek, if you do that and they know that your interest is pure and you're interested in their own health, and you have a cancer concierge service, and before I left, we did cardiovascular disease as well. Then you get rapid adoption. This plan was voluntary. 85% of the workforce volunteered to enter this plan.
So I think just in looking at, now we understand the birth of Bird Health.
Yes.
After 20 years, Steve has retired and gone to create his own healthcare company. But I think the couple points I want to just point out, once again, is doing good is good for your employees. A number of people have union workforces. In this case, what percent of your employees are union, Steve?
It'd be about 85%.
So the opportunity to have, quote, a win-win for your employees and yourself. And lastly, the creativity of raising money. And we're going to pass this on to the CDC Foundation. But the idea that people going through a check stand can donate money, average donation of that $200 million is $2. So how do you collect small amounts of money from large numbers of people and processes? And I think you had calculated, Steve, you got it down to 6 cents
Yes.
per transaction
Right.
is the cost?
And if I could just add one thing, that most people that reduce healthcare costs, there's been quite a shift, over to the employees, and I think that shift actually puts more personal accountability in there and is not all bad. But in Safeway's case, not only did the population get healthier, but their costs went down and the company's costs went down. And so those savings were shared across the board.
So Bob, I'd like to go to yourself. It was 1993. We had a meeting in the Mansfield Room, Senate office building, giving out scientific awards, and one of those winners is with us today, Andy von Eschenbach, prior to becoming the head of the National Cancer Institute and the FDA. And it was a time when Clinton Healthcare was introduced, and prior in this period of time, the most admired company in the world was Merck, the largest pharmaceutical company, spending more on research than anyone in the world. And for almost the entire period of time that these judgments were being made, among the top 10 most admired companies in the world were constantly leaders in the biosciences. A year later, they were now a company charging too much for their product and were not serving society, etc. And the value of the company fell by almost 50% in a year, and the world changed, and many companies reduced their science budgets to increase profits, and 20 years later, the industry is much different. Is there a relationship here in this area of public health, world health, doing well, good business is doing good, etc., and the link to the industry? As both the CEO of a large pharmaceutical biotech company and as the head of pharma, obviously these issues weigh on you today.
Absolutely. I think the world has changed. I really honestly do believe we're on the verge of the real golden era of being able to capitalize on the revolutions of information technology and molecular biology. I think that the story that you frame there is one that we all have strong perceptions about, and I think sometimes it's hard to break down perceptions. But I'm so optimistic about the future because I do think the world has changed dramatically. The fact that somebody from Celgene is the chairman of pharma is like, I don't know how that could possibly happen. 20 years ago, it certainly couldn't happen. And I tell you, I have been so blessed to meet so many people in whether it's NIH or FDA or CDC and every large company around the world focused in the area. And I think we're in a time of real aligned interests. I think that where 10 or 15 years ago, the industry might have had certain issues. And I think today the principle, if you don't make a meaningful difference in improving the quality, length of patients' lives, there's no business proposition. So whatever might have happened 10 or 15 years ago, the world is completely different today. And I think that we are also, I think part of it because of the economic recession we've been through, the fact that we're here today and we're talking about really trying to accelerate the collaboration, whether it's with CDC, NIH, FDA, all of the different components, including insurance companies, of the ecosystem of biomedical innovation, is so critical. We don't have the resources for everybody to do it themselves. We've got to find solutions that are integrated. We need the thousands of companies that get started, like Rajiv spoke about, that have a 95% to a 99% chance of failure. Their great risk, their dream is most likely to fail, but we don't know which of those 2,500 are going to produce that advance forward. So we need people who are willing to take the risk and sacrifice their future financially to put everything on the table for the upside of that. So we need all the components of it. I do think the ecosystem is really positioned today to capitalize on it. And I don't think we have a choice. The issues that we face, we need bold solutions and we need integrated solutions. So I think the industry has changed tremendously. I think we all have to make sure that on our side, we really look to collaborate as effectively as possible, and we don't have biases of the past as to how it was hard to do this or hard to do that. And I think we all need to find the ways to focus on the positive aspects of really accelerating the pace of change, because the consequences are so serious if we don't work together to bring about the real realization of the potential that's out there for us.
Thank you, Bob. And Judy, why don't you tell us how you got to the CDC. We are in awe of many of the people that work here who have dedicated their lives and have dealt with so many issues. What career path did you take to get to the CDC?
Well, thanks for the question, Mike, and thanks for your leadership and for the summit. This has been terrific. So before I answer how I got to CDC, I'd like to say to all of you, if you remember one thing from the summit, I would recommend that you remember that CDC is vital to a healthy economy. And that's partly why I'm here. I was a practicing family physician, seeing patients one at a time. That's what I thought my career path would be. And then along the way, I was growing more and more frustrated with the children coming in that had childhood obesity, hypertension, failing physical exams, smokers that I realized things were going beyond the walls of my office. The impact of health was really outside of that office. And I was called in 2005 by Mitch Daniels to be the state health officer. And I couldn't say no. I mean, when the invitation to go into public health and have an impact on that broader base. And then after 5 years of being state health officer and having gotten involved nationally, I had the great privilege to come here to CDC to stand up a new office to help support all of the health departments across the country.
So as you think about the business case, you had a governor that was very focused on the business case, that created incentives, compensation for people who could solve problems or improve things. How is that carried forward to your visit here and job at the CDC?
Yeah, I've always carried that. I learned a lot from the governor in terms of the economic impact. And so the work that we do here at CDC and the office I'm in, again, supporting all of the health departments, we support the big issues. You heard this morning a lot about infectious disease and the value of CDC, but really chronic disease is the burden that's really driving the cost. And when healthcare costs is at $2.8 trillion and 75% of that is chronic disease, that's where we start looking at the value of prevention and what CDC is all about.
I think for those that saw the chart earlier showing you the cause in the United States or the wealthy, quote, countries of disease, you see almost all of them are lifestyle related. And just the sheer concept that over 2.5 billion of the U.S. economy is highly related to lifestyle, it just tells you the potential that's in front of us and programs that Steve has outlined, etc. We live in a very international world. And we've heard at the CDC how international the world is and how small the world is today. Mehmood, I can't think of a company that's more international than PepsiCo. We've had a number of people at the Milken Institute always remind us that culture beats strategy all the time. So you think you have a strategy, but there's a culture. And as the world moves and things move quicker, culture becomes even a more important element. You've been working on changing the culture of PepsiCo, and you've been working in many ways of dealing with new products and services and dealing with different cultures around the world. Could you maybe talk about that experience, both the PepsiCo culture prior to your arriving and today, and the culture of your customers, consumers, etc.?
Well, if you think about PepsiCo, a 100-year-old company, very successful, doing business in essentially 200 countries, reaching more than 1 billion people a day. And it took a century to build this entity that's a global icon. And you sit there, we have a great CEO. I joined the company about 6 months after Indra Nooyi became CEO and chairman. I was her first senior executive hired, with a very clear mission, and that is the future of our industry is different to the past. And it's different for two reasons. And I think, let me just state a few contexts, because we think about global challenges and all the tremendous opportunity. I personally don't think there's a bigger opportunity than the food industry has looking ahead. Let me explain that. The world's population today is 7 billion. There's 1 billion people hungry. Population of the planet by 2050 is going to be 9 to 9.5 billion. There's going to be 2.5 more billion consumers on the planet. We're not getting more water, and we're not creating more land. And 98% of the world's population buys its food from the private sector. And so if you think about how we're going to feed 2.5 billion more people in a global world, in a world where we're going to be worried about obesity and lifestyle disease on the one hand, and massive hunger and starvation in another 2 billion people on the other hand, at the same time often living in the same country, sometimes in the same city or village, with a global supply chain, then you have to be a global company, thinking about the global challenge. And yes, it is going to be good for the consumer. It's a heck of a business opportunity too. But, and I put my hat on when my days at the Mayo Clinic, when I was an endocrinologist practicing, teaching nutrition at the University of Minnesota College of Agriculture, and I've come to appreciate that what we taught as science, and Bill Dietz right here was somebody who helped me understand obesity. I hired George Menza from the CDC to join my team at PepsiCo. So I was able to have the privilege of leveraging people right here from the CDC and NIH, help us understand these issues, and here's something we often forget. Nutrition science is a global science, is multinational, knows no boundaries, other than a little genetic variation. But you know what? People don't eat nutrition, they eat diets. And diets are culturally very, very powerfully relevant. And if you think about doing business as a food company in 200 countries, you don't have one formula for 200 countries and 500 cultures. You have to think about a global supply chain, individual nutrient at a time, but individual diets at a time. And I can tell you, in this day and age, even more so in a very connected world, consumers want their version of their diet, their culturally relevant version of their diet, and actually their interpretation of what they think is healthy. And believe me, a person like me goes to a cocktail party or a dinner, I've heard every single idea of the next flavor, next version of product. It starts with my wife at home, all the way through to my in-laws. Now, the reality of it is, we have to think about this as feasibility. And let me leave you with one other thing that we have to think about as challenge. People ask, what is it that we're working on? We've increased our R&D budget at PepsiCo by 50% in the last 5 years. Very significant investment in all aspects of science. But you know what? 40% of the world's fruit and vegetable supply rots after it's harvested. It's not a shortage of production, it's a shortage of being able to stabilize it, distribute. And you heard this morning, if you don't get it right, it's also the fastest way of spreading disease very quickly. Contaminate the food supply. So when we think about global business, the complexity of understanding this can have massive benefit for the consumer, massive opportunity for our retailers, and at the same time, tremendous opportunity for the business. I can't think of a better win-win.
And I think also we see an intersection between the food companies and the abilities to deliver potential pharmaceutical products or other things as part of that distribution, and whether it's in yogurt or something else that they might take. And our own efforts over the last 20 years to try to change diets, what we've tried to do is make food look the same, taste the same, smell the same, and change the ingredients. But we only have to serve it to 20 or 100 people and not have to package it and move it around the world.
Can I just respond to that? I mean, most people think of PepsiCo and they think of one branded product. Very few people realize that we own Quaker Foods, we own Tropicana, we own Sabra, the hummus company. We are the largest baby food company in Russia. We own Naked Juice, we own Tropicana, right? And so, yes, that's true, but as we've been transforming, what few people realize is if you tell the consumer that you've just lowered the sugar or the salt in this product, they actually stop buying it. They think you've changed the taste. I don't want it. And yet, let me give you a couple of statistics. Since 2006, we've taken out 3,400 tons of sugar in our beverages in the US alone. 3,500 tons. We didn't tell the consumer, we just took it out. We took thousands of tons of salt out of our food products, didn't tell the consumer. And if you go from there, if I look at the portfolio of PepsiCo's products today, and it gives me a lot of pride of what we've achieved. In 2006, if you go back to the early 2000 era, about 10% of our beverages in the US here were low sugar or no sugar. Low sugar meaning less than 40 calories a serving. Today, that 10% is 50%. 50% of our portfolio today is low sugar to no sugar. If I project out to the future, another 5 or so years, it's probably 60% or greater. The consumer's changed. But how do you talk about it? Because when you tell the consumer we've changed the product, you actually lose the consumer and leave them behind. So what we have to figure out is how to do the right thing, continue to grow our business. This is very different to when I was in pharmaceuticals, because if it didn't taste good, you just put it in a capsule and you swallowed it. You cannot do that with food.
Thank you. Bob, we have a number of representatives today from academic centers, medical centers, universities, etc., with us who lead their efforts. Is there a way that you think that we could work better with these academic research centers in the pharma bio industry? And I'd ask the same question of Rajiv too.
Definitely, right? I think we obviously can improve in everything we do, but I'm very excited about the fact that there are so many different initiatives going on that really are exploiting that kind of mutual interest and finding the right role for people to do. Just in New York City, before Mayor Bloomberg left office, the whole idea of building a culture of small biotech companies formed out of the academic medicine area in New York City, which has really not happened to that economy. When you look at the economy of Cambridge or San Diego, San Francisco, and parts of New Jersey also. And Eli Lilly, ourselves, and GE were the three corporate partners that said we will come in and help sponsor that and have a new model of saying let's be a participant in helping these academic medical institutions spawn off little small companies off of their startups out of their strategy. And there's so many other strategies going on with ways to, because of the funding crisis in academic medicine. I have a conference call on Monday for a proposal that we're looking at a whole new funding source that actually will securitize future royalties of a collaboration of scientists from 6 different institutions with corporations participating and collaborating and really building campaigns against certain targets. So I'm very excited that there are many, many different ones. I think we should spread that information better so that we don't wait for it to gradually get out, because the thing that strikes me even last night and today that concerns me is that we all share the same goals. We see the same information, but I don't feel the panic of the risk to our prosperity if we don't do these things faster, more efficiently, and so I'm optimistic about the things that are going on. There are lots of good examples of creativity, innovation, and changing the way we do things. We need to accelerate it because the consequences, both on the upside and on the downside, are so serious.
I think we sometimes don't really reflect on what's happened to society.
I'd give you, I just had a thought that came to my mind, and I'd agree with everything Bob said. And I'll give you an example of the last sort of 24 hours. I'm on the Mass General Research Advisory Council, and one of the initiatives that they have there is to try to save costs in the hospital system, in the Partners Network that employs about 100,000 people in Boston and Mass General Hospital. And one of the studies there found that the largest amount of costs are in a very small group of patients, related to the 80-20 concept. These are patients that have very serious multi-diseases that are very poorly managed, that show up at the hospital unforeseen, and then they cost the system a lot of money. And the problem in the hospital system today is that we don't have this patient-level data. But we do have the tools in bioinformatics in Silicon Valley with big data to very rapidly get all this information on a patient-level data. So this working group has actually done this. And then the other thing that they realized there is that the current hospital system is not organized to manage these patients. And a big problem in the hospital system is that a lot of these high-risk, high-cost patients have a gap in their care. That is, there's no continuity from the primary physician to going home. So what MGH has done is that they've come up with a new system, which is called which is a care manager system, where each of these high-risk patients has actually 2 primary contacts. One of them manages them through the MGH system and works along with their primary care physician. And as a result of this initiative, the MGH system in the last 8 months has saved about $14 million. And what stands out to me is this is just about how the future is going to evolve, where, predictive bioanalytics is going to really play an important part in managing costs, in trying to anticipate problems and thereby save dollars to the system. At lunch, I was sitting with Dr. Michael Bellier at the CDC, and he was telling me that a study done here at the CDC found that hospitals in the United States can have a 70% reduction in the transmission of blood-related diseases if they followed the CDC protocols. So once again, this is just, this is going to happen as the world gets more connected, as we become more cost-conscious as a society. A third point I'll make here is I talked to a gentleman, Rob Gertzen, in a lab in MGH. He published a paper about 2 weeks ago in Cell Metabolism, where he discovered a molecule, it's called BAIBA, it's an amino acid that it basically works with the gene that turns white fat into brown fat. And so this is a major finding. And so how do you put all of this stuff together? Essentially, you find these high-risk patients, and then you try and do a genotypic analysis of them. You put them in a system with much better longitudinal care, in a system which is coordinated with other hospitals across the country so that there's all these best practices. And then you give them preventive medicine, potentially give them a drug that can turn this gene on or off because this patient has a high risk of cardiovascular disease. And I think this is just an example of how all these different elements in society can come together to solve these questions around better outcomes and better cost management.
Judy, you worked for a governor who interacted and wanted to do more things with the for-profit business in Indiana. How do you see the interaction at the CDC, and what could we do to improve it with for-profit companies?
There's lots of opportunity, and I think in the summit already today we've heard some exciting opportunities such as mobile technology and how we can advance that and reach folks in different ways. We've got reaching out to academia and to business. We have science here at CDC that we know works. If you take something like childhood obesity, where we really need to make a difference, a great example of that is where Cargill came in, working with CDC, and they give mini grants out to elementary schools. But the catch here is for the schools to apply for the mini grant, they have to actually fill out something called the School Health Index that's evidence-based. It's been developed here at CDC. So you'll have 600 elementary schools go through the process of evaluating what they're doing in the schools, come up with an improvement plan. Maybe 40 or 50 of them will actually get grant funding. So I think those kinds of strategies where we use CDC science and connect with philanthropy and with business. We've got to also think about things like tobacco. And if I might, I want to give one shout out. We here at CDC, when you look at the strategies for combating tobacco, one of those is hard-hitting media, and I hope all of you have seen the TIPS campaign, where we had a lot of focus groups showed us that if you took smokers and smokers that were currently smoking would give tips to others. This ad went out, and we've got with us today Leisha Hancock, who was a 20-year, Leisha, stand up a minute. Leisha was a 20-year smoker, had tried to stop. Her husband begged her to stop. She even had some throat irritation, I understand, used antihistamines. That nothing made her stop. Then she saw one of the hard-hitting, really graphic ads. And in the ad, Terry Hall, a woman who had laryngeal cancer, was speaking to smokers, giving her tip, saying that really what you should do is record your normal voice when you're younger, reading so that your grandchildren can hear your voice, because she'd had a laryngectomy. Very graphic, very powerful, and that ad is what drove Leisha to quit. So we need to make sure that we're learning the lessons from successful campaigns like that and taking them to scale. So I think with our work with businesses, I would say skill, taking to scale, and innovation.
Well, one, I want to thank the panel for joining us today. I think we've heard a number of things. If I was to summarize a few of them, one, tremendous opportunities going forward in the bioscience area, and probably a lack of capital at different levels. Two, I just wanted to emphasize that something that stands the test of time more than almost anything, countries, even religions, are our leading academic universities, research centers, particularly those in this century that will be involved in bioscience, and the tremendous opportunities for new partnerships and paradigms that we think will occur. Three, that we've heard today, the exciting potential for a company in the consumer food and packaging business that Mehmood talked to us about. It's hard to find an individual who isn't more excited about the future for his company, and the ability to go inside with the right leadership and the right from the CEO down and change a company from within that's been around for 100 years. And the excitement of being able to do that. In the case of Steve, I think bridging the gap between management and employees and bringing forth new partnerships that are not only substantially increasing the profits for the company, but substantially increasing the length and quality of life. So thank you very much for joining us, and I think Tom's going to come up and kind of summarize the day, and we're going to go on some tours for those that want to.
Well, first, I really want to thank Mike Milken for bringing us together. This is truly unprecedented. Never before in the many decades of CDC history have we had such interest from such a broad group of people with such enthusiasm. So I want to thank you, Mike, for bringing us together. I also want to thank all of you for bringing your vision, your curiosity, your interest, your questions, frankly, your skepticism, because we welcome that. At CDC, we welcome what Dr. Khan mentioned, kind of an impatience, an obsession with impact. We ask the question, how can we make the most possible difference? And some of the things that I've heard today have been really interesting and will change the way we think and change the way we approach problems. I know that you know, but I now understand better, that the business of business is to understand the future better. And that understanding health is essential to that. I know that we all know, I think, better now than we did this morning, that a healthy economy is absolutely reliant on a healthy population, healthy people. And there were some terms that I had actually never heard before. Planetary health, that Judy Roden mentioned, and thinking about what all of the impacts of our efforts are and how we can work together to make a difference. The idea that what we strive for is excellence without arrogance. I've always thought it was a weakness of CDC that we're very reluctant to brag about what we do. In fact, there's an ethos here that you will find in the hallways that it's great if we save a lot of lives, and it's even better if nobody knows we did it. And I've always thought that that was a weakness because it makes my job a lot harder. But I think maybe it's a strength. I hadn't heard the term ecosystem before, but we try to avoid having CDC be an ecosystem, but we are an essential part of the ecosystem that builds health in our communities, in our businesses, in academia, in philanthropy, and globally as well. I also heard the phrase, which I hadn't heard before, that CDC is the gateway to health. It was a nice phrase and a nice way of thinking about what we try to do in monitoring and guiding and empowering people so they have more power to make decisions for themselves, their families, their communities, their businesses. I also heard about new models of philanthropy, new models of entrepreneurialism that have the opportunity to blur the boundaries in a good way between what government can do, what civil society can do, and what we can do together. We heard from patients. And it's always important that we keep patients first. So I want to thank the Nahums for sharing your story with us. It's very, very powerful. And it reminds us that as a former CDC director, Bill Foege, who led the smallpox eradication efforts, was director here, helped at the Gates Foundation to start the Gates Foundation work, ran the Carter Center. And Bill likes to say that we in public health are at our best when we see and we help others see the faces and the lives behind the numbers. And I think that's what you've done to come forward and share your story. And congratulations, Leisha, for your progress staying smoke-free and telling us really that we can take pain, we can take tragedy, especially if we can plow that into more progress that we can make to protect other people and to help other people be healthier and more productive. Today, while the event was going on, I got, as is usual, a couple of urgent emails. One of them relating to the water situation in West Virginia, where we continue to work with the people there and the communities there to ask and answer questions. Another about a white powder situation relating to the Super Bowl. I'm sure it's all going to be fine. But put yourself in our shoes, in my shoes, that every day we're dealing with threats. Some of them are very apparent, white powder that might be anthrax. Some of them may be less apparent, like the obesity epidemic that we discussed this afternoon. But all of them require creativity, and most of all of them require partnerships. We have to work together across society with business, academia, government, different parts of government, individuals, philanthropy, and only by that collaboration will we get the synergy to help us in our communities, in our country, in our world, reach the potential that we can reach. So I want to really thank you all so much for spending your precious time with us. We treasure the time you've spent with us. We thank you for it. We invite you to a reception in the museum where we'll be able to mingle, chat, and think about concrete things that we can do together to build those partnerships, that community, and to fulfill the promise that stands before us. Thank you.